I really do believe that the benefits of being in an in-person school setting far outweigh the risk of COVID, which is what we're all worried about right now. For children who are under 12 years old and who can't get vaccinated, we need to give them additional protection so that they do not get sick. Many children get therapies at school and, speech therapy, physical therapy. These are things that all happen in the school setting, not to mention the learning, interaction, the friends, the exercise you get at recess and with PE. These benefits far outweigh the risk for COVID. The likelihood that they can catch COVID is about the same as everybody else, right? So if there's someone with COVID in their vicinity, they can catch that disease. They're not as likely, based on the data that we know, they're not as likely to get seriously ill with it. But some children have gotten ill. No parent wants their child to have that risk. So we want to do as much as we can to minimize it. And again, going back, wearing a mask, hand washing for the child, socially distance from those who you don't know their vaccination status. The American Academy of Pediatrics has come out with recommendations, and that there should be universal masking for all children aged 2 years old and up, and really for all the people around them. We definitely want the unvaccinated to wear a mask, but masking the children who are also vaccinated does a couple of things. One, if they're sick and don't know that they're sick with COVID, because people who are vaccinated can become ill, they won't spread it to other people. The other thing it does is it helps to prevent monitoring. How do we know that somebody is vaccinated or if they're unvaccinated and choosing to not wear a mask? We don't know by looking, and it's not really reasonable to ask for ongoing monitoring, and we don't have that as a mandate. Yes, I do think that riding the bus is okay, but you need a mask, right, to get the best protection that you can get. Some parents may feel that they don't want their child on the bus, and they have the ability to take their child in a different way to school, and that's okay. That's okay. But that the people who do need to ride the bus, we need to weigh the benefit of being in school, which far outweigh the risk right now. One of the things that we know is that the risk of catching COVID from food preparation is very, very low. And so I believe it is safe to be eating the food provided from the school, including the school breakfast and the school lunches. You want to know about vaccinations. Do most of the teachers and staff, and you're talking about even, the environmental cleaners for the school, are they vaccinated? What's the school's policy on the teachers and staff wearing masks? What are they doing in terms of cleaning the school, in terms of surfaces? And we don't need to go overboard, but there should be generally a level of cleanliness that's going on. And what is the policy on distancing? Are the school desks set further apart? What happens at recess? What happens at lunchtime? And you want to see that the school, has been thoughtful and has answers for you. They may not be able to do everything, okay? But the more that teachers are aware of what they can do, the better off for everybody.